I'm MaryBeth Bernardin. I'm one of the pediatric emergency medicine doctors that works at the emergency department at University Hospital. As a parent, I understand that when your child or your baby is sick, that can be really difficult, and it's natural to want to have your child checked out by a doctor. There are multiple different places where you could have your child seen by a doctor or healthcare professional, including your regular pediatrician's office, urgent cares, virtual visits, and also the emergency department. If your child is having symptoms of what we call a URI, or upper respiratory tract infection, those symptoms can include cough and congestion and runny nose and fever, but they're still breathing comfortably and they're eating and drinking and keeping themselves hydrated at home, then it can be appropriate for you to continue to provide care for them at home. Very often, children may experience sore throat, ear pain, sometimes rashes. Symptoms like that are very often appropriate to be seen by the regular pediatrician. That could be at their doctor's office or a virtual visit or urgent care. So there are several things that family can do at home to help their children and their babies when they're sick with these viruses. A major thing that you could do is try to bring down fever. Whenever your child's body is making fever, they will naturally breathe a lot faster and sometimes a lot harder. So if you can bring down their temperature with Tylenol or ibuprofen, then a lot of times they will breathe much more comfortably. Another really important thing that you can do for your children at home and your babies is to suction their nose. That can be done with a bulb suction or a nose Frida or other devices you can get over the counter. If you still feel that your child is having difficulty breathing, that could be a good reason to bring them to the emergency department. Respiratory viruses frequently will cause symptoms for as long as 7 to 10 days. Some viruses, like RSV in particular, can cause cough and congestion that can linger for 2 weeks and even longer. If your child is still coughing but is not having difficulty breathing, that can be perfectly normal. If your child has been having fever for prolonged periods of time, particularly for 5 days or longer, then they should be seen by a doctor. That can be at their regular pediatrician's office or urgent care. So one of the first things that we'll do when your child or your baby is seen at an ER or at a doctor's office or urgent care is we'll check their oxygen level. And if they need extra oxygen to keep their oxygen level at a normal place, then they need to stay in the hospital. Another major reason why sometimes children need to stay in the hospital is if they're having really significant difficulty breathing. And what I tell families to look for is if their child is using extra muscles to help them breathe that they don't usually need to use. Using their belly to help them breathe, their belly going in and out with breathing, sucking in between the ribs and above and below the collarbone, and sometimes flaring of the nostrils. If your child or your baby is having a hard time keeping themselves hydrated at home, or if they're vomiting so much that they can't keep down fluids, especially if you're seeing a decrease in their urine output, that can be a sign of dehydration, and sometimes that can be a reason why children need to stay in the hospital or need to be assessed in the emergency department. If your child is sick this winter and is experiencing serious symptoms that you feel need to be addressed in an emergency department, we are always happy to see you and take care of your child or your baby. At the same time, we are seeing increased volumes of patients this winter, and there have been increased wait times. We appreciate your patience, and we hope that you and your child will feel better soon.